Thank you so much. And I really appreciate everyone who contributed to examples around stigma. Today, we're really going to talk about substance use and mental health stigma, but a lot of the concrete strategies that we're going to talk about, I think, are going to have a lot of applications even in many other types of healthcare settings, not just thinking about like substance use and mental health, because as many of you've highlighted, there's so many ways that people might interact with the healthcare system more broadly, where people might be treated differently because of their age or their weight or their gender. There's so many different examples of that. Really, this training is all about like being client centered, treating people with dignity and respect. And that's really at its core at the end of the day. So I really appreciate everybody for sharing. I'm going to go ahead and briefly introduce myself, and then we're going to jump right in. I look forward to a lot more conversations together. So my name is Grant Hovik. I'm a clinical specialist and a clinical trainer at UCLA Substance Use and Addiction programs. We're really excited to be working together on a series of behavioral health echoes, and we're thinking about what would be a good topic to kind of start it off in. Stigma is a good overarching one. Just super briefly, what we do at ISAP is we're a research lab that studies the science around substance use and co-occurring disorders, and I work on the training side. So my job is really to take science and research and to share it with providers like you all. And we work really closely with providers all across our region more broadly in the state of Hawaii and Health and Human Services Region 9 more broadly too. So just super briefly, very excited to be here, and I'm really looking forward to our conversations together as we talk about stigma and how to be really more client centered and to meet people where they are, which is a theme that we're going to talk about a couple different times today. So thank you all so much. One more just super quick disclosure. My work is sponsored by a variety of local, state, and federal grants and agencies. The views expressed today are my own and don't necessarily reflect that of our funders. All right. So I want to talk a little bit more about substance use stigma and also what stigma is more generally. And this icebreaker was such a perfect example, especially as many of you shared real life examples that you've seen in your own personal experiences. Many of you shared in your professional experiences as well. I want to very briefly talk about where that word actually comes from itself, because it really does say a lot. So the word stigma really, it comes from the Greek word meaning tattoo or brand. It was a mark made on the skin by pricking or branding as punishment for a criminal. So it was viewed as a sign that criminals were unsafe, unclean, and unwarranted. This kind of perpetual mark that these type of people are different and need to be treated differently in the broader society. And I appreciate this definition because substance use in particular has very often been seen as a moral problem, that these are bad people who make bad choices and we just need to punish them and separate them from the rest of society and hope that that fixes the things. But as many of you all know, that really is not very effective. Substance use is a healthcare problem. People need treatment and recovery. But how people perceive folks with addiction makes a big difference, whether they show up to their primary care appointments, whether they show up in other community health settings, whether they show up in mental health settings. How they might be treated differently makes a big impact on their health overall. And this stigma is really prevalent, not only mental health and substance use stigma, but we can see it in other areas as well. Uh, the barriers that keep people from getting, especially the addiction treatment that they need, are pretty broad. Like there's a lot of different components to it, although awareness and stigma really is a big example of it. So, stigma itself refers to negative attitudes, beliefs, or behaviors that are directed towards individuals for a particular reason, whether it's a substance use disorder, a mental health disorder, or other aspects of who they might be, like you shared in the chat earlier. Especially in the substance use context, it's still a huge roadblock for people getting the help that they need. Even admitting to oneself, I might have a problem and I might need help from it. This is not just something that I can do by myself. We also know, especially in mental health, there's a lot of cultural considerations around how people perceive what mental illnesses are and the ability for folks to ask for help. Stigma comes from a lot of different places. Sometimes it comes from within, where people tend to blame themselves or feel hopelessness, which is a big barrier for recovery. Sometimes there's stigma from the recovery community more broadly. People have disagreements around what treatment and recovery looks like. So sometimes people, particularly, might have disagreements around the role of medications in recovery. And just to be super clear, medications are life-saving tools in the tool chest that can be a matter of life and death for some people. So in terms of the evidence base, these medicines are often the gold standard, especially around challenges like opioid use disorder. Um, Sometimes there are stigma from other clinicians. Some of you shared in the chat examples of this earlier, where certain types of providers might view substance people who use substances as not deserving care, or they treat them differently because they are using cannabis. They might not treat them with the same amount of respect because they're using methamphetamine or opioids. And then stigma from the general public as well. I shared a little bit about this earlier, this kind of deeply held view that substance use is a moral problem, that these are just bad people, as opposed to this is a healthcare condition that can benefit from treatment. Um, I also want to take just a quick moment and talk about how stigma can also be unique in rural communities too, because there's also considerations to be mindful of. Every rural community is different, as you all are very well know. It's not a one size fits all approach, but broadly speaking, tends to be somewhat more conservative ways of life. So views around substance use might look a little bit different. Um, Social norms as well in rural communities, there's more of values around self-reliance. I'm going to handle things by myself. I don't necessarily need to ask for help around certain things. And especially when that's around substance use, for many people, like community and support are really critical. Tight-knit community dynamics as well can also play a role. If I ask for help, what are my family going to think? Or what are my neighbors going to think if they realize that I might have a substance use problem, especially where in small towns and rural communities where people know each other and people talk. These privacy considerations also play a big role as well. If I drive up to the clinic and people see my car outside of the addiction clinic, everybody's going to know, hey, that's my car. They're going to know I might be struggling with an addiction. So, all of these and other factors can have unique considerations when we think about treatment, when we think about recovery and healthcare in rural communities in particular. There's also quite a few strengths. Uh, Churches, school groups, community organizations. There's also a lot of opportunities to build on those peer support networks that are pretty strong in rural communities too. And technology platforms also very helpful. Um, how do patients respond to stigma? One big response that people often have is avoidance. I'm going to avoid going to the doctor because I'm afraid of how I might be treated. Or I've been treated poorly before and I don't want to go through that disrespect again. I'm one counselor that I saw didn't really treat me with dignity that I think that I deserve, so I'm going to be a little bit more apprehensive, rightfully so, asking for help from somebody else. Um, this not only has impact on substance use needs, but that also plays a role in managing chronic medical conditions, whether it's high blood pressure, or diabetes, or getting help for depression or anxiety disorders. Um, and in the substance, so that has impacts on physical health, mental health outcomes. And there's a lot of research that shows when people hold stigmatizing beliefs around addiction, they're much less likely to go to treatment and they don't stick around as long. And substance use is a chronic condition for many folks that really does need a long-term perspective. Secrecy, hiding, shame, all of these are common coping mechanisms that people employ to try to deal with stigma. I'm just going to hide from it. I'm not going to tell anybody. I'm definitely not going to tell a healthcare provider. And I'm going to try to deal with this on my own. And while some people are able to manage on their own, that tends not to be the majority of folks. And since substance use also has a strong, complicated relationship with the criminal justice system, because again, as a society, sometimes we use the justice system to try to help with healthcare problems, especially substance use. That also adds other layers of stigma as well. So not only might be people have shame or internalized stigma around being a person in recovery, there's also a lot of stigma around being involved in the justice system. When people are on probation or parole, it can make it more difficult to find a job or sometimes even get access to housing as well. I cited some data on the screen as well. The involvement in the justice system in and of itself can make it more complicated for people to get help, to seek treatment, to get employment, or to get access to housing. So stigma is pretty complicated, and there's no magic bullets to it. There's no like cure-all silver bullets here that's going to magically fix it. But one thing that all of us can do is think about how we talk about people in recovery and how to be client-centered when you're building relationships and engaging folks. So a little preview of what we're going to talk about in terms of how to address stigma. So I want to share an example. This comes from Dr. Kelly at the Recovery Research Institute. They do incredible work around stigma and really to put like facts and science behind it. So I'll share, this is a really powerful study that comes from their lab. They did a study where they had general population, like general subjects, general people, and they were interviewing them, and they presented them two hypothetical scenarios. One was referred to as a substance abuser, quote unquote. So let me give you an example. You know, Mr. Williams is a substance abuser and is attending a treatment program through the court. As part of the program, Mr. Williams is required to remain abstinent from alcohol or other drugs. They presented a second hypothetical. The main difference was instead of being a substance abuser, this was a person having a substance use disorder. So a more person-centered way to talk about somebody. Again, almost identical scenario, but instead of a substance abuser, this Mr. Williams has a substance use disorder. Everything else was the same in these two descriptions of these folks. And when they asked the participants to rate them based off of different metrics, they rated the substance abuser as being less likely to benefit from treatment, more likely to benefit from punishment. They were more likely to be socially threatening, so they were more afraid of this person. And they were more likely to blame them for the substance use challenges rather than believe treatment might be beneficial for them. And most of all, they just needed to gain some self-control. Try harder, buck up, pull yourself up, and deal with it on your own. And really, the only key difference here was how you describe this individual as a substance abuser or the more person-centered approach, a person with a substance use disorder. So this study was really foundational in helping us understand that how we talk about recovery and how we talk about your patients is really, really important. And it's something small that I certainly have control over in how I talk about people in recovery. Even going beyond this example, especially in addiction treatment, our culture, we've adopted a lot of terms that if you really pause and think about it, there's a lot of shame that's really embedded in it. We describe people as being clean and dirty, for example. We really do. We talk about people being clean or dirty based off of whether they use a substance. And if you talk about people that way, it starts to sink in. It starts to internalize on how they view themselves. People who use substances are not dirty. They're not bad people. They're humans who deserve respect and deserve health care, deserve a chance to help improve their health. So it makes sense that if we think that substance abusers, quote unquote, should be punished, don't really benefit from treatment, it makes absolute logical sense that if I'm a substance user, I'm going to hide. And I'm not going to be honest with my doctor. I'm not going to be honest with my nurses. I'm not going to be honest with healthcare providers that I might encounter. And I'm definitely not going to be honest with my family or my loved ones. This leads to this vicious cycle of secrecy and hiding and avoidance. So you might get diagnosed with a stigmatizing condition. I might feel some of that discomfort with and shame around that. So I'm going to hide, not tell people that I know. Eventually, if that healthcare provider finds out that I've been hiding a stigmatized condition, I almost feel double the shame now because now there's judgment involved because I wasn't honest and I wasn't open. And that cycle tends to repeat itself over and over again. So I want to share some really powerful quotes. This comes from Biancarelli and colleagues who published a study around stigma with people who inject drugs. And these are really just powerful quotes from their research. I'll read it for you. When it comes down to it, a lot of the times that I need to get medical attention, I put it off and put it off and put it off because I feel I don't want to face the embarrassment they make me feel. And that's not fair. It's not. Really, really powerful. Um, their research really highlighted and demonstrated how instead of accessing these healthcare services, when people like Stacy in the quotation that I just read, they often will delay. And we see this in rural communities too. People tend not to go to the doctor until it's absolutely necessary, until their health has gotten really unmanageable and maybe they're in a lot of physical pain or emotional pain. They're going to wait as long as possible and put it off because sometimes there's fear of how I might be judged. And that often lends people into the emergency room. So language is a piece of the overall puzzle. I want to share this quote from Don Coyes. He's a substance use counselor, and he works really closely with Native Americans. He's the founder of White Bison Incorporated, which does incredible work in helping Native Americans who are impacted by substance use. So he says, if you want to care for something, you call it a flower. If you want to kill something, you call it a weed. Um, these are both nature's creatures. How we talk about things really does change how we think about it also. So, a couple concrete strategies. We've shared the healthcare system is complicated. There's a lot of moving pieces, and access to healthcare can be complicated, and stigma also is complicated. So, I want to share some practical tools that we all do have some control over that can affect how you engage people in your work. One really practical example of this is how you talk about people. How you talk about people, how you talk about your patients makes a big difference. And these are people first. These are humans. These are your neighbors. These are your community members. And that comes before their diagnosis or their health condition. So, I'm not here to tell people, be the language police and tell people what they're allowed and not allowed to say. That's not what I'm speaking to here. What I'm speaking to is if I want to try to build a relationship with somebody, I want to treat them with respect. And one way I can treat people with respect is try to be person-centered. So I'll give you a couple examples. Um, Rather than describing somebody being clean and dirty, this person had a positive urine drug screen or a negative urine drug test. It's more specific. It's focused on the behavior and not an aspect of who they are. They're not clean or dirty based off a urine drug screen. Instead of calling people criminals and convicts and things like that, there are people involved in the justice system. They're people first. Same thing when it comes to substance use. Rather than being alcoholics, or there's a lot of other colorful language around people with addiction that I'm not going to repeat a lot of it, but this is a person in recovery or a person with an alcohol use disorder, a person with a methamphetamine use disorder. Same thing applies with mental health examples as well. Rather than schizophrenics, this is a patient with schizophrenia. Um, just like if I have diabetes, that diabetes doesn't define who I am as an individual. That diabetes is not my entire life. I'm a person first, and my diabetes is just like a challenge that I'm facing or part of my lived experiences. I think it's a helpful framework to kind of think about that. So one thing that I can have control, and I invite you to think about, is how you talk about your patients in both in front of them when they're in your office or when they're at your agency, but also when you're talking to other providers, how you talk to your colleagues, how you talk to the other members of the treatment team. I still want to be respectful and try to use some of those more person-centered language and avoid judgmental terms when you're talking with your peers, when you're talking with your colleagues or your supervisors too. Um, if you hear a colleague who uses language that might be stigmatizing, especially might be hurtful for some people. One example that I have is pull them aside. You don't want to embarrass them and ask for permission first. Like, hey, Grant, I appreciate you sharing that example of the patient that you're working with earlier. Would it be okay if we talk for a moment about people in recovery and stigma? I find that asking for permission first, would it be okay if we had a quick conversation, can make it a little bit less awkward to bring that up. But you want to advocate for your clients, just like you want to advocate for their healthcare overall. Again, not here to be language police and tell people what they're allowed and not allowed to say, but When you think about the experiences of your patients, every staff member at your agency is important. From the moment they first walk in the door to what they might be, what the receptionist might say, to what the security guard might say, like down to every person they might interact with. Um, Great question in the chat. What if the person says no? I love that question. Hey, would it be okay if I shared some feedback with you? And they're saying no. I want to honor that and I'm going to try later. I'm gonna say, okay, maybe now's not a great time. I will come back and I'll check in with you a little bit later. That's how I would handle that. Because respecting the choice and respecting autonomy is really critical, but also helping to advocate for your patients and treating people with respect is also important too. So I want to honor that. No problem. We'll talk about it a little bit later. And of course, always talk to your supervisors as well. If you hear particularly harmful terms, particularly terms that are really, really painful for some people, talk to your supervisors, get their support too. Excellent. Great question. Yeah. Persistence. Absolutely. Persistence. So I want to share language isn't everything. It's a piece of the overall puzzle, but really using patient-centered, client-centered approaches, all of this is helps to reduce stigma as well. When you meet with an individual and you show that genuine curiosity to get to know them and understand them, that is also part of reducing stigma. Because when the patient shows up to your clinic and they know, hey, I know the staff here is going to treat me really well, that really opens the door for them to be vulnerable and to share with you. So, understanding where they're coming from. In the substance use context, it's also honoring people have very valid reasons that they're using substances in the first place. Um, Oftentimes, there's functional reasons, whether alcohol helps with their anxiety, or they're using cannabis because it helps with their pain, or they're using stimulants because they're living on the street and they need to stay up at night to protect themselves and protect their belongings, or they're using it to help give them energy. There's often functional reasons that people are using, and we want to understand what those are because clinically, that's going to be really, really important because you're understanding, oh, there's functional impairments that need to be met and they need to get some tools to help them manage their their mental health or their physical health. But then also in terms of the relationship piece, it also shows, hey, the provider here, they really get me. They're not judging me for what I've been through and what choices that I might have made in my life. Um, Understanding of their readiness to change and adjusting accordingly. If you're working with a patient who may be mandated, or maybe they're there because a family member is insisting they come to the clinic and they're not happy about it. Um, my strategy for engaging needs to look a little bit different. I want to try to build rapport and raise awareness. Plant seeds. Identify what their health needs are, and some of the ways that their substance use has impacted their life in different ways. As you all know, substance use impacts so many aspects of life, from mental health to physical health to family, to your relationship with your kids and your loved ones, to your work, to your school. Want to try to understand holistically how substance use might impact them. And I appreciate some of the examples of stigma in the healthcare system earlier. Our healthcare system sometimes can be a little bit siloed. Um, and sometimes it's not always easy to talk to each other. Seeing your clients holistically as a whole human being with complex needs also helps with this person-centered approach. And think about ways to provide services that are going to be responsive to their readiness to change, and also is responsive to not everybody is interested in sobriety overnight. Reductions in use are sometimes a stepping stone, and it's the first step in the right direction for that individual. Keeping themselves safe, reducing risks around their substance use as well, conversations around naloxone or not using alone, or even things like, remember, put 988 in your cell phone in case you have a psychiatric emergency. You just, at the middle of the night, you need support. And I spoke to this a little bit earlier, but empathy and non-judgmental approaches go a long way. I know I'm definitely speaking to the choir with this particular group. but when you're working with a person who's not happy to be about being there or just afraid, just really scared, am I going to be treated with dignity? Am I going to be disrespected like so many other people in my life? You really have to go the extra mile and prove through action. I'm not here to judge you. I really want to get to know you and where you're coming from. Even if you don't have a lot of time, just a couple questions. Tell me about what's important to you. Tell me where you're coming from. What's that been like for you? You can do this very, very briefly. I know relationship building does take time. I don't want to minimize that, but just a couple minutes here and there to try to understand where they're coming from can make a big difference. Um, I mentioned earlier stigma in the justice system also. Justice involved clients often have very negative interactions with institutions and people in power and healthcare providers. Respecting their autonomy is also really important, although that's true really for all your clients. Um, this the comments that I was mentioning about language and empathy, all of this goes to trying to make people feel comfortable to be vulnerable because it takes a lot of courage to show up to a clinic and ask for help, especially when they're scared, especially when, in my culture, we don't talk about mental health. It takes a lot of courage and a lot of resilience to be vulnerable and ask for help. And we want to reward them for that vulnerability and not punish them. Um, Even things like offering your clients and their families something to eat or something to drink, especially thinking about their community needs and when they might come in for the first time. Counselors, therapists, medical providers of all different times, focusing on types, focusing on strengths, resiliency is really important. In addition to their functional impairments and their healthcare needs. Um, and additional examples of ways of being person-centered also comes to setting goals together. Thinking about their healthcare goals, part of that is also figuring out what is most important for that individual. I know many of your clients that you work with, your patients have complex needs, especially when it comes to substance use. It has huge impacts on so many aspects of life, like I mentioned. They often have a lot that's going on. And so I want to take time and figure out what is most important to them. Where would they like to start? Whether that's their mental health goals, their chronic medical conditions like their diabetes, or whether it's their methamphetamine use. In their view, what's most important? And I want to start there. And then as a provider, you can help them see how actually their methamphetamine use is also connected to their diabetes management. And their methamphetamine use also has impacts on their relationship with their family or their loved ones. This all goes to speak to trying to empower clients to take ownership over their own decisions. Um, um, as sometimes, especially with clients who feel like they've been told what to do by so many people in their life. Have you ever had the client that shows up to your office and they're like, "All right, just tell me what to do and I'll do it. Um, I'm here, fix the problem." Or sometimes we see that with youth and their parents, like their parents will bring their young person in and they'll be like, all right, you're the therapist, you're the doctor, fix them. And it's like, it doesn't quite work that way. It really is about empowering them to take their own journey because recovery is different for everybody. Treatment, healthcare is really different for everybody. And I can't do it for them. We really want to honor them to make their own choices and try to help support them in making choices that are going to improve their health. So counselors, medical providers can be sources of support and guidance along the way. Anytime you have small successes, we want to acknowledge that and really to reinforce that. You've been doing a really great work at taking your medication this week. That's awesome. How did you do that? I know you were really nervous about going to that psychiatry appointment and you did it. Tell me how'd it go? Um, I know you were you were worried about going to those AA meetings that we talked about recently, but you did it. That's incredible. How'd that work? How'd you make that happen? Just getting curious about their successes in honoring that as well. When barriers come up, which is absolutely inevitable, try to work together to think about what are their community resources, um, who in their life might they be able to ask for help or for support, um, and try to work together on overcoming them. There's a lot of case management that can come up too. So I just want to leave you with a few kind of concrete tips, and then I want to open things up for. I have a hypothetical case that I want to share with you all, and then I would love to hear if you have any clinical examples we can bring in and talk about. So just to kind of summarize, we talked about stigma from a variety of different perspectives. Um, Stigma is a huge barrier for people getting the healthcare that they need, especially around conditions like substance use and mental health, where there's a lot of shame, there's a lot of fear. I People say all the time, meet people where they are. And it is really, really critical to not just say it, but to really follow it through with action. So what that means is not judging people for what they've been through, which being non-judgmental takes work. It takes support and supervision, because you're going to work with so many different, and you do work with so many different types of people. Some people with very similar lived experiences as your own, and people with very, very different upbringings and very different life circumstances. And it takes active work to be non-judgmental in those moments. And support from your supervisors is really critical with that too. Um, that also means understanding their motivation and trying to align your strategies accordingly as well. If you're talking about like ideas for a medication adherence, for example, I want to try to make sure we're talking about strategies I is realistically going to do and involve them in the decision-making process too. Because, pill boxes might work for me, but other people, reminders are a much more better tool. So everyone's a little bit different in what they might need. Um, Couple other things. When your clients show up, just remind yourself how much effort it took for them to really be there. Now, sometimes that is financial effort. They had to take time off work. They had to get a babysitter. They had to get a family member to watch their kids. They had to take a bus, or sometimes in rural communities, they have to drive a really long distance to get there. Um, just remind yourself how much effort financially, work-wise, and also emotional effort it takes to show up and to make yourself vulnerable. And so show appreciation for that. I really appreciate you coming in today. I know it took you two buses to get here. Thank you so much. I know last time you were here, you shared that you live quite far away from the clinic. I really appreciate you coming in today. Um, and also just, be mindful. It takes emotional vulnerability too to do that as well. If a client shares something with you that might have been difficult to talk about, like they share a little bit about their mental health, or they share a little bit about their addiction, or maybe their HIV or hepatitis C, um, show appreciation for that. I really appreciate you sharing that with me today. Um, I know it's not always easy to talk about your feelings, especially with someone you don't know as well. Thank you for sharing that with me. It really can go a long way. You can also remind your clients, like, I'm here to get to know you and understand where you're coming from. And I'm not here to judge you for who you are, where you might have been. And remind them, I'm here to try to help you. And I'm also not here to try to force you to do something that you don't want to do. At the end of the day, the choice is ultimately up to you. And if you're honest in those statements and you're genuine and authentic, it can really, really make a big difference in how you engage people, especially folks who are showing up with a lot of fear or a lot of shame. Also, if you work with clients who may be quote unquote challenging, they they show up to the clinic and they're not always happy about being there, or they show up to the clinic and they don't always answer your questions, or they question your authority, or they're just more difficult, challenging to engage. It can be helpful to, when you know that client's coming in, just pause for a moment, do a little grounding, remind yourself like this patient is suffering, and they're going through a lot right now. I'm grateful that I don't have to suffer like that, and I still want to do my best to try to treat this person with respect, because I know the some of your clients have very complex needs.